Welcome to our third annual Birth Defect Day Instagram live event. World Birth Defect Day is a time to spread the word about preventing birth defects and organizations who support birth defects research and resources for families affected by birth defects. I'm Robert Felix, past president of Mother to Baby. This year, we're going to be talking specifically about COVID-19 vaccines in pregnancy and while breastfeeding. I have here with me two of our Mother to Baby experts. They co-chair our Emerging Issue Task Force, which currently focuses on COVID-19 and COVID-19 vaccine. We have Lori Harris-Agaribay from our Mother to Baby North Carolina affiliate office and Kirsty Parada with the Mother to Baby California affiliate office. Ladies, thanks for joining me.
Thanks for having us. It's great to be here.
Great.
Thank you, Robert. Happy to be here.
It's good to see you. Before we dive into questions and answers from our expert panel about COVID-19 vaccines and booster in pregnancy and breastfeeding, I just want to take a moment to say hello to those of you joining us live. We'll be taking questions from you live. If you have questions about COVID-19 booster in pregnancy or breastfeeding, go ahead and start asking them in the comments and we'll get to them as best we can. I also want to recognize some of the organizations in addition to Mother to Baby supporting this special event and who are part of the planning for World Birth Defect Day events. They include the Center for Disease Control and Prevention, also known as the CDC, March of Dimes, the International Clearinghouse for Birth Defects and Surveillance and Research, the Society for Birth Defect Research and Prevention, the National Birth Defect Prevention Network, Food Fortification Initiative, and there are many more supporting this effort. So let's go ahead and get started. Let me see what we have here. Perfect. Okay, so the first question that just came in, so let's start with this. So someone's asking, why do I need to be vaccinated? And is COVID really worse for people who are pregnant?
Yeah, that's a good question. So let's start with the disease itself. So at this point, we do know that COVID in pregnancy is associated with a risk. We have studies that show that when a person gets COVID during pregnancy, they are more likely to be admitted to the ICU, more likely to need a ventilator, and also more likely to die. We also know that having COVID in pregnancy is associated with risks to the baby. So both a higher chance of preterm birth, which is delivering before 37 weeks, and a higher chance of stillbirth as well. The CDC does classify pregnancy as a medical condition that would put someone at increased risk of severe illness from COVID. So staying up to date with your COVID vaccines, as well as taking other preventative measures like wearing a mask, is going to be very important for this group.
And Robert, if someone who is pregnant also has certain other underlying health conditions, they can have an even higher chance of getting very sick if they get COVID-19. So if they have an illness like cancer or diabetes, if they have a weakened immune system because of a certain medical condition or medications that they take, being a former or a current smoker, having obesity, having a substance use disorder, and even certain mental health conditions like schizophrenia or depression, these can all increase someone's chances of getting very sick if they have COVID-19. So for someone who has one of those underlying health conditions, in addition to being pregnant, it's especially important that they take all the steps they can to help prevent infection, and that includes staying up to date on their COVID vaccines.
Great. So let's talk about the vaccine. There are still 3 that are available. Is that right? And a question here says, it's from a viewer who wants to know if there is one that's preferred for pregnant women or pregnant people at this time? Is there a better choice for one of the 3, or what are you saying?
Yeah, so there are still 3 vaccines available in the United States, and most of the published pregnancy data is for the 2 mRNA vaccines, which are made by Pfizer and Moderna. Pfizer and Moderna were available before the Johnson & Johnson vaccine was, and you may remember that the Johnson & Johnson vaccine was put on pause for several weeks last year.
Right.
So simply because of the fact that more people have gotten the mRNA vaccines in pregnancy, it's been easier to collect data on them. So that doesn't mean that there's any expectation that the Johnson & Johnson vaccine would be harmful during pregnancy. It's just that there's not nearly as much data on pregnancy outcomes in people who got the Johnson & Johnson vaccine. But pregnancy aside, the CDC now recommends that for most people, pregnant or not, the mRNA vaccines are preferred over the Johnson & Johnson vaccine, and that's for both the primary doses and the booster dose. So that really answers the question about which kind of vaccine to get. But as far as any preference between Pfizer and Moderna in pregnancy, there is none. It's really a matter of personal preference and which vaccine may be available to someone.
All right, good. All right, so let's go to the next question. But before that, I just wanted to say again, if for those of you, if you're just joining our Instagram live discussion, Mother to Baby and organizations around the world, including the CDC, March of Dimes, Society for Birth Defect Research and Prevention, NBDPN, and many more others are recognizing World Birth Defect Day today. And we are commemorating this by taking questions from you, the viewers, about COVID-19 and the vaccine during pregnancy and breastfeeding. So if you have questions, please send it in the comments and we'll try to get to it as best we can. All right, so on the topic of birth defects, what can you tell me about vaccination in the first trimester? So this caller just found out she's pregnant and has a question about whether she can go ahead and get vaccinated at 6 weeks, or is there a better time to wait?
Great question. So I can take this one. At this point in time, the first trimester data is still somewhat limited, but we do have two pretty well done studies that did not identify an increased risk for miscarriage when the COVID vaccine is given early in pregnancy. So that's definitely reassuring. I know for a lot of people that are newly pregnant, miscarriage is definitely a concern for them. So having this data that does not suggest any sort of risk from the vaccine is definitely helpful to see. We also have another study that recently came out, which includes more than 2,000 pregnant women who received the Pfizer COVID vaccine. So that's one of the mRNA options in the first trimester of pregnancy. And they did not find any sort of increased risk for birth defects. So more good news there. And it really makes sense that we're not seeing any sort of risk associated with the vaccine, since we don't really expect that the components or ingredients of the mRNA vaccines would be able to cross the placenta and reach the developing baby. So if it's not getting to the baby, it makes sense that we're not seeing any sort of risk. So that's definitely reassuring. So getting back to your question, no risk has been identified when the vaccine is given early in pregnancy in the first trimester. So there's really no need for you to wait to be vaccinated. The sooner you get the vaccine, the sooner you're going to be protected against COVID.
Yeah, when we talk about the first trimester, Robert, one thing we want to think about is the possibility of fever. And fever is a possible side effect of any dose of a COVID-19 vaccine. We don't like to see a high fever that lasts longer than about 24 hours in early pregnancy. But of course, a fever can also happen when someone has a COVID-19 infection or for other reasons. So it's not as if delaying the vaccine guarantees that someone won't still get a fever. Usually acetaminophen, which is like regular Tylenol, is recommended to treat fever in pregnancy. And it's quite effective at keeping a fever down when it's taken as directed. So overall, given what we know about the safety of the vaccine and the importance of staying as protected as possible from COVID-19 during pregnancy, there's no recommendation to delay any dose of the vaccine in the first trimester or at any time in pregnancy.
Fantastic. Good to know. Wait, can you hear me? So, Percy, you mentioned data. So let's talk more about the data that exists, because a question has come in saying, how many studies have actually looked at the use of COVID-19 vaccines in pregnancy? Are there one, a few? Are there many? I mean, it's hard to do studies in pregnancy, so what's available there?
Yeah, good question. So, early on when the vaccines first came out, we really didn't have a lot of pregnancy data, since it takes time for researchers to collect this information, right? Pregnant people have to get the vaccine, they have to deliver their babies, researchers have to collect that information. So it's just a matter of waiting sometimes. But now, 2 years into the pandemic, we do have a lot more data, which allows us to be much more reassuring about the use of the vaccines in pregnancy. So like I touched on earlier, we do have a few studies looking at vaccination early in pregnancy. So those two that did not find a risk for miscarriage, and then the newer study that did not find a risk for birth defects. And as time goes on, we're hoping to get even more first trimester data. So we'll hopefully see that soon. And then we also have multiple other studies that include thousands of people who received one of the mRNA vaccines during the second or third trimester of pregnancy. So again, the mRNA vaccines being Pfizer, or what's now called Comirnaty, or Moderna, which is now being called Spikevax. And these studies have not identified any sort of risk for pregnancy complications. So researchers were looking to see if the vaccine was associated with problems like preterm birth, babies being born smaller than expected, stillbirth, or neonatal death. And reassuringly, they did not find anything to suggest a concern there. So to answer your question, lots of data at this point. We're at a really good point where we're able to have this information that we can share with people that contact our service. And to date, no risk has been identified when the vaccines are given in pregnancy.
Another thing that studies have been able to look at is the antibodies. And, after someone gets the vaccine, their body makes antibodies against the virus. And so an added benefit of getting the vaccine in pregnancy is that those antibodies can pass to the developing baby, even though the vaccine itself doesn't reach the baby. And we knew from earlier studies that antibodies were reaching the baby because there were antibodies found in the umbilical cord blood at the time of delivery in people who were vaccinated during pregnancy. So that meant the antibodies were passing through the cord to the baby. And now we have a study that was published just last month showing that getting vaccinated against COVID-19 in pregnancy significantly reduced the chance of the baby being hospitalized with COVID-19 during the first 6 months of life. So that was really important because it showed that not only are those antibodies passing to the baby, but they are appearing to actually provide some protection to the baby during infancy. The majority of infants who were hospitalized in this study were born to people who were unvaccinated. So there is more and more data showing that getting the vaccine is a benefit for the person who's pregnant, for the health of the pregnancy, and now also for the baby.
So you bring up a good point about antibodies and passing it on. So with other vaccines, after getting vaccinated, there's a point where sometimes the antibodies wane. So what about booster? Is that any different? We have actually here a question that someone's asking, should she get a booster now or should she wait until after she delivers since antibodies are passing? What are you saying about that now?
Yeah, so this is a question we get all the time at Mother to Baby, so I'm glad someone did ask it today. So first, talking about the data. So we don't have data technically on the use of the COVID boosters in pregnancy. However, we know they do contain the same ingredients and either the same dose if we're talking about a Pfizer booster or even less dose if we're talking about a Moderna booster as the original shots. And like we just went over, the pregnancy data for these initial vaccines when they're given in pregnancy does not suggest any sort of risk. So we wouldn't expect that the booster shots would be any different. We also have some helpful recommendations in place from the professional groups, including the American College of Obstetricians and Gynecologists, ACOG, as well as the Society for Maternal Fetal Medicine, who both strongly recommend that pregnant people get the booster shot at any point in pregnancy. There's a lot of unknowns still about the exact timing of getting a booster, but like Lori just went over, it does look like those antibodies are reaching the baby when the vaccine is given during pregnancy. So definitely somewhere we need to research more, but it is looking promising. So to answer your question, there's no need to wait. You can go ahead and get that booster as soon as you're due for one to make sure that you are protected as possible against COVID. Because Robert, like you mentioned, those initial vaccines unfortunately do kind of wane over time. And so it is really important to get the booster on time to make sure that you're protected once again.
Great. Okay. So speaking of baby, let's maybe shift gears for a second and talk about breastfeeding. What's the latest there? I know, let me see what I hear. Someone wants to know if they get a Moderna vaccine while breastfeeding a 2-month-old. What are the thoughts on that? Do you have any thoughts or?
Yeah. So we have not quite as much data on breastfeeding and the vaccines, but encouragingly, studies have found that the mRNA from the vaccines is very unlikely to enter the breast milk in any significant amount, if at all. And if any small amounts did make their way into the breast milk, they would probably be destroyed in the baby's stomach. So just like in pregnancy, the baby is not exposed to the vaccine itself through the breast milk. But the antibodies that a person makes after getting the vaccine while breastfeeding have been found in the breast milk. So it's not clear yet how much protection this might provide to the baby through the breast milk, but studies are looking into that question now. But in the meantime, it's very reassuring that studies haven't reported any serious adverse reactions to the vaccine in the people who are breastfeeding or in their infants. So at this time, there's no recommendation to postpone breastfeeding or to discard breast milk after getting the vaccine, regardless of the baby's age. So even in that very young 2-month-old infant, getting the vaccine is still recommended and not expected to be harmful for the baby.
Fantastic. Let me see here. I'm having a hard time seeing my comment box. Are there any other questions? Can either of you see any of the comments? Are there questions?
Yeah, I was just taking a look, and I think, Robert, you kind of hit all the major ones. So looks like we answered most of them. But of course, if anyone has follow-up questions about COVID itself or the COVID vaccines, we always have experts available to answer them. So please feel free to contact our free service if there's any remaining questions. We're happy to go over the latest data with you.
Wonder if you can comment briefly before I thank our participants about pregnancy studies. How many? Do you have a sense of how many folks out there are doing studies, pregnancy or breastfeeding? Is it mother to baby collecting data on women who are exposed? So many of the women that you get to counsel or talk to are encouraged to participate. Can you briefly mention that or talk about that?
Sure. So of course, lots of different organizations are studying COVID vaccines during pregnancy, and mother to baby is one of them. So we are definitely enrolling people who have, been exposed to one of the vaccines. Anytime someone contacts us for counseling, we do always ask if they're interested in participating in the research. It is completely optional. It's up to you if you want to participate. It's an observational study design. So what that means is that we never ask you to get a vaccine or take a medication. We basically just look at what you choose to do, the decisions you make, and then follow the outcome of the pregnancy to try to learn more. So if it's something you're interested in learning more about, you can go to our website, mothertobaby.org, or again, you can contact the counseling service and we'd be happy to put you in touch with the right person.
Great. Thanks for sharing that. All right. I think that's it because I still haven't seen anything come through my comment box here. Well, that's all we have time for, or at least for now, what we have for the World Birth Defect Day discussion. I want to thank my colleagues Lori and Kirsty for joining me to answer all the great questions that were asked today. I also want to thank all the organizations supporting this live broadcast and partnering with us for World Birth Defect Day. And again, that includes the CDC, March of Dimes, the International Clearinghouse for Birth Defect Surveillance and Research, Society for the Birth Defect Research and Prevention, National Birth Defect Prevention Network, Food Fortification Initiative, and many more around the world. I am Robert Felix, and if you have any additional questions, please reach out to Mother to Baby. A link to our website is in our bio. There are many ways to get in contact with our free service. All of them are listed on our website, mothertobaby.org, including how you can chat live with an expert. In fact, two of our chatters are here, Lori and Kirsty. Why not consider participating in our mom and baby follow-up program? So it's something that Kirsty had mentioned, the observational pregnancy study, and it provides crucial medication safety info for moms and providers so that they can make better treatment decisions. Our website provides information on how to get involved in our studies if you're pregnant or a healthcare provider who can, in North America, to refer your patients to our program. We'd also like to encourage you to get involved with some of the World Birth Defect Day partner organization in whichever country you're joining us from. Many of them have valuable resources about birth defects and prevention. For that information, please visit worldbirthdefectday.org. And thank you again for joining us.